Hello, I'm Dr. Irene Stein, and I will be the host for this research symposium session entitled The Experiences of Physicians Who Implement a Whole Food, Plant-Based Diet as a Treatment Modality for Chronic Disease. We're excited that you have joined us today to hear Jennifer's presentation. The chat window will remain open during the session, so please feel free to participate or ask questions. Jennifer will address chat questions during the last 5 minutes of the presentations. So please welcome Dr. Jennifer Leeder. She's a 2018 graduate of Ashford University, formerly University of the Rockies. She graduated with a PsyD with a health and wellness psychology specialization. She holds a master's degree in counseling psychology, which she got from the Adler School, and she's currently a certified holistic health coach from the Integrative Institute of Nutrition and is a published author. So please welcome Dr. Jennifer Leeder.
Thank you, Dr. Stein. Thank you, everybody. Welcome to my presentation. So today I'm going to be introducing the Physician's Toolbox to promote healthy change through lifestyle medicine. Physicians can help their patients make significant lifestyle changes that impact their health and well-being. Assisting current doctors and those being trained on how to do this is probably the single most important change the U.S. health industry could ever experience. The prevalence of chronic disease is a growing concern in the United States. Prevention is the most affordable and effective way to prevent and/or reduce the risk of chronic disease. Natural whole food plant-based diets have been used all over the world to prevent and treat various diseases for thousands of years. There is evidence being presented on the benefits of eating a whole food plant-based diet. And we kind of see this everywhere these days on the news and in books. But however, there still does remain a very large gap between promoting this type of health and nutrition and the medical community and the information that they're receiving. So today, my presentation aims to assist physicians to implement a lifestyle medicine toolbox, including a plant-based diet as treatment modality will help effectively change eating habits and lifestyle in their patient population. This toolbox will also address the barriers and challenges and also the successes that a plant-based diet plays in patients' treatment. The information being presented was gathered through one-on-one case study interviews that I conducted with these physicians during my dissertation and research project. And these physicians have implemented the whole food plant-based diet modality into their practice. So let's start out here. We're gonna just kind of move down here. My interview questions for these physicians that I used to take a look at how they are implementing these plant-based diets. So some of the questions that I had asked them, just having them explain what their definition of a plant-based diet is, what the formal training that they received or completed to become a plant-based doctor in their practice. And I looked at what model they were utilizing in their practice. So it varied across the board between different certifications that they had received. I took a look at what specific approaches they were using with their patients that made them unique or different, and what they believed most helped to inspire the change that they were seeing with their patients. And, one important thing is kind of to take a look at a time span and what was helping them to maintain the change over time. Because as we know, it's easy to initially adopt changes, but to actually maintain them over time and take a look at, how they were achieving success with their patient populations and what tools they were using to measure progress, what type of medical testing that they are using in their practice to see these changes. One important thing for me and that I've discovered was influences that motivated the change, but also really taking a look at those specific barriers and challenges, which we know can really impede on someone's success to losing weight, to successfully get started on exercise programs, and you know, taking a look at some of those perceptions also that the patients have. You know, how do they perceive the specific barriers, the severity of their diagnosis in making those changes for themselves? And then what strategies have they implemented to be effective in their practice? Let's take a look here. So taking a look here at a quote by the Cleveland Clinic, the root cause of chronic disease is lifestyle. So during my dissertation and the interview process, I came across 7 themes across the board with all of these physicians. So taking a look at these 7 themes, we came up with the nutrition education that the physicians were receiving and the lack of nutrition education being taught in medical schools. The discovery process was one of the themes that really helped them to implement plant-based diets in their practice. So when I say discovery process, this is the process, the approach that they are using with their patients initially upon intake. So building that trust with the patients and getting to know those patients, which I'll dive into a little bit deeper in just a moment. Another theme that I came across was the severity of diagnosis. So that really played a big part in these interview process with the patients, is understanding, you know, in relative to what a patient's diagnosis is, how severe it is how willing they're likely to make a change. So if, for instance, they're just given a minor diagnosis and they aren't typically seeing any symptoms per se, they had received a blood work back, they weren't really feeling sick, is that going to make them, you know, feel that change versus, you know, being told they have a diagnosis that they might have very severe symptoms and pain and, you know, maybe have a terminal diagnosis to go with that. So that's what we're looking at with severity of diagnosis. Taking a look at the demographics and culture of a patient. So, you know, specific areas and regions across the country definitely play a part into who is most likely to adopt these lifestyle practices. So, you know, one big thing when I was interviewing physicians across from California to Georgia, definitely saw differences in those patient populations where it's more prevalent to practice holistic medicine, yoga, healthy eating, versus some of the deeper south states where they don't have as much access to this type of lifestyle practice. So that definitely played a part with these physicians. Another theme that we came across was spousal resistance. So how likely are you to implement a plant-based diet when you have a spouse that's resisting that type of a treatment plan? And then taking a look at the physicians and are they prescribing an actual diet or tools to give their patients that are going to help make them successful, and what solutions are they offering those patients for the future? So these themes that were uncovered during the dissertation process and the case study that'll lead into my presentation and my toolbox provided a deeper insight into the experiences that these physicians believed were the most important factors in counseling their patients to lifestyle change. It's also been reported that barriers, in particular spousal and partner resistance, were the most important hindering behaviors to their practice and implementing this type of physician lifestyle change. So the study contributes to social change by serving as a guideline for the creation of effective strategies for physician practices when implementing lifestyle medicine. So again, taking a look at the questions that were asked of these physicians, and then taking a look at the discovery process. Number 1 is motivational interviewing. So throughout that discovery process, using motivational interviewing techniques to deep into the different strategies, the health histories, asking patients for permission, offering them tools and support. And then we have our patient themes again. So next we're going to dive into lifestyle medicine as the component of this toolbox for physicians. So taking a look at healthy eating practices, physical activity, how they manage stress, relationships, substance abuse, and sleep. And those are 6 areas that are the focus to improve upon. So let's stay here on this slide for a minute. So just following the recommendations for practice that I am making based on my learning objectives. So for physicians, really understanding the importance of nutrition and health and education for training regarding a healthy diet. So suggestions are comprehensive education and healthy living skills, and also for the physician themselves to implement or make healthy changes and choices in their own personal lifestyles. So, you know, what I've noticed when talking to these physicians that was key is using personal inspiration to help instill positive social change in practice by using this information to implement. So, you know, with most physicians having limited hours of training in medical school, most of their inspiration or success story came from either a family member or themselves having a diagnosis and making those changes throughout their own personal education process, whether it be reading books, watching movies. Most of them also obtained a certificate from an outside source, such as the American Academy of Lifestyle Medicine, and there's some other ones as well. T. Colin Campbell has a program, a plant-based program that, you know, a significant amount of these physicians were, you know, seeking outside certifications from. And then the physician's health practice strongly influences patient practices as well. So again, just taking a look at their own personal inspirational stories. You know, and many of these patients face obstacles that prove to be a challenge for adopting healthy behaviors. So, and one suggestion for these physicians is to set an agenda for the patient's visit, create the opportunity to talk about diet, exercise, weight loss with the patient, and assess the patient's readiness to make weight-related behavioral changes. Accessing the patient's readiness to make those changes, and then what obstacles do the patients feel like they are challenged with. So not just giving suggestive advice, but also taking a look at where their challenges are and helping them through those as well. You know, and to do that, one approach is to use a stage match counseling strategy to move the patients closer to achieving their goals, and getting to know the patients on the first visit is definitely a key to guaranteeing a higher rate of success on future visits. So the physicians really need to learn how to take and build that relationship in their practice by earning their trust and understanding a patient's why through listening, supporting and educating a patient through these components needed to create an environment of adherence. Placing an emphasis on the role of discovery, again, that process to help achieve positive engagement outcomes through listening and understanding the patients will most likely help them to achieve their positive outcomes. Also understanding the fundamental of health behavior change, the severity of diagnosis, which we touched upon. Patients are much more likely to adopt healthy behavior when they feel the extent and discomfort or harm of the diagnosis has a will effect on their well-being. So also discussing the patient's challenges and barriers to address their areas of concern, allow them to self-reflect in your conversations. Asking the patients to give input into the conversation enables them to identify and discuss areas for improvement. So giving them the tools to be successful and also helping them to empower them throughout that process. According to the health belief model, perceived behaviors is one of the top reasons people foresee difficulty in adapting change. So again, you know, another a key role is for physicians to actually ask permission to engage the patients in their care. It's likely to increase the chance that they're going to be more involved in their decisions about making those health changes. Next, we move into assessing patients' BMI and dietary patterns, taking a look at their health goals, risk readiness to change using motivational interviewing tools, using evidence-based collaborative method of selectively focusing statements made by the patients to motivate their behavior. So really taking a look in that discovery process about what they're saying and modeling that back in their conversations to help motivate them. That helps the physicians to show their patients that they are listening truly to what the patient is saying, and then working with them to implement diet changes and physical activity changes. And most of these certification programs will give you those tools on how to help put together diet plans and exercise plans to actually give patients those tools to use. Also taking a look and agreeing with the patients on those specific health goals and plan of action by making sure that the goals are specific, measurable, achievable, realistic, and time sensitive. Be very supportive of the goals given. But with that being said, taking baby steps throughout the process instead of jumping all in at once. Creating a specific written lifestyle plan with the patients, both identifying those realistic short-term goals and then giving them a look at that long-term goals, including manageable steps that are specifically defined and can be measured. And then making recommendations on specific tools and support services, including professional groups in their community, group counseling, family support, having the patient identify what their particular support system would be. That could also include group exercise classes and personal trainers, social supportive services that can help support their commitment. And then providing patients with email, text, and phone information that will help keep them accountable by using smartphone apps and other tools. And I will list those tools at the end. A few of the physicians told me, especially in smaller practices, that they give out and text their patients on a daily basis, just motivational quotes or other type, a feedback, talking back and forth through text, just to keep them accountable. Which may not be likely in all physician practices, just depending on the size, but what works well for these physicians. And other list of resources that can be given out are documentaries, books, podcasts, smartphone apps. And then I'm going to go down to, let's see if we can shrink that up here a little bit. We're kind of missing the bottom, but here is some of the following recommendations for these that can be given out. I think some of these are ones that we've all heard of, and I know that there's some newer ones out as well. So Food Matters, Fork Over Knives, Be Educated, What the Health, Parent Nation. And then I could send out a copy of these slides to everyone. We're having a little technical difficulty here on the last slide, but some of the books that I've recommended are A China Study, Whole by T. Colin Campbell, who is the godfather of lifestyle medicine, Preventing and Reversing Heart Disease by Caldwell Esselstyn, Engine 2 Diet, The Plant-Based Solution, The Cheese Trap by Dr. Neil Bernard, and then we have Super Immunity by Dr. Joel Furman, and How Not to Die by Dr. Michael Greger. And then several of the smartphone apps are Fitbit, Map My Run, My Fitness Pal, Fujicate. And then lastly, I actually did speak to my own physician recently who I had asked her advice about the Apple Watches, which I recently purchased one to try their health app. And they have a heart monitor on there that she said is actually showing a lot of really positive results, can be uploaded to your physician's office and they can get some, good detailed information out of that. The physician's main goal should be to inspire, engage, and motivate to bring out the best in their patients. Being genuine, modeling trust can significantly help establish a successful physician-patient environment and maintain a collaborative climate of trust throughout the process, getting the patients inspired to achieve these goals in their personal lives. So that concludes my presentation today. So thank you again for allowing me that time to present my research. This concludes my presentation, but I would like to invite you to ask any questions you have. And then again, I out a copy of my slides as a couple of them did get cut off. Fortunately, the Mac didn't format correctly, but if you're looking for the information, happy to send that out. So thanks again.
Wonderful, Jennifer. I've been following the chat. There is a lot of enthusiasm about all of this, myself included. I just absolutely love the slide that has your lifestyle medicine slide with all um, six, six aspects to that, 6 areas. I think that's wonderful. You should put together a toolkit, with that as the front. I have a question, but Dr. Peggy Sundstrom has a question. She says, this is great information. However, I wonder if physicians are resistant to the amount of time this process would take. I have a great physician, but she's booked so tightly that I can't imagine her spending the amount of time that would be necessary to help a patient like me with these issues. Did you get pushback from physicians about the complexity of this process? How do physicians get around the time constraints?
Absolutely. So, Dr. Sundstrom, one thing is I did choose physicians that were currently already using this in their practice and had found, as I suggested, certain certification programs that are shorter programs on how to introduce these tools. So these were specific physicians that are very passionate about this type of a practice, and so the time constraints were not of importance to them. However, when speaking with many other physicians outside of my dissertation, I have found that that is one of the contributing factors to why most physician practices might, be excited about this, think that it's the right direction. However, feel that they are not, informed on how to go about this. Again, how to have the time for this. I do know that one suggestion and one thing I have seen in a few physicians' offices, especially larger practices that can afford to bring on a health coach or another service that might go in conjunction, or also recommend a private practice or a lifestyle medicine counselor or doctor that they can refer out to. So they might have the belief that this is, a great way to go about it, and then refer their patients to somebody else.
And that goes along with Gail Brunell, who's now Dr. Gail Brindell, who graduated last year. Let's see, how are these providers implementing this lifestyle medicine? Do they get a health coach, exercise specialist, counselors? Are there opportunities with the implementation process for professionals like yourself and actually Dr. Brindell to assist?
Yeah, that's great. So one of the physicians that I interviewed, who has a very, very well-known physician and very large practice, he said the majority of his practice is like lifestyle counselors that are brought on to actually consult the patients. So he might see them initially and then oversee their care, their medical care, yet he has these lifestyle counselors in his practice that are working directly with the patients. So there's definitely those practices out there that are looking for these type of counselors. I see more of them listed on LinkedIn. Some of the big health systems now, for instance, I live in the Chicagoland area close to Wisconsin, and I see the entire Wisconsin, UW-Wisconsin medical system. All the hospitals are now hiring lifestyle counselors into their practices to work with the physicians. So, it kind of just takes a little bit more creativity to find these jobs. But I do think that, especially right now with what we have going on in our nation, people are looking for alternatives to build their immune systems, to stay healthier. Just what we see right now, going on with COVID and everything. So, I think definitely this is a great time to be getting into this type of field. And if you want to reach out to me, I'm happy to talk to you about different places I've seen, or places that you could look to get this type of work.
That's good. Yes, Dr. Gail Brindell did want to reach out to you, and I don't. The presentation that we were on right before this from Shira Jones, who's still finishing up her PsyD, was about teaching self-care to mental health professionals, and it seemed like your presentation seemed to to overlap. So there was a suggestion that you two get together also. I've
Yeah.
got one last question. Since there are students on this call, and you graduated a couple of years ago, how has completing your applied doctoral project on this subject and having your PsyD, how has that changed? How has that changed what you do or who you are these past 2 years? What have you done with all of that?
Absolutely. So, one thing I've done, I have been working on building up some of a website content with my information. It's not released to the public yet, but I do, come across a large amount of physicians that, so through Facebook, for instance, is one of them, and LinkedIn is the other. I have had a lot of physicians send me a request just to be a connection, and they're looking for this type of information. I've had a couple of physicians say they would love to, such as you suggested, introduce this into their practice. They don't necessarily have the time and energy to devote to a full certification program, so they're looking for simple advice or tips. So one thing I'm working at is to try to simplify the things I've learned from this presentation, and like you said, Dr. Stein, take those 6 areas and really try to put together some information for them. I also currently work in senior living, so I work with some of the lifestyle teams in senior living. It really kind of plays into, most of the older generations that are looking to move into assisted living and independent living are looking for lifestyle change. How do they live a longer, healthier life? How does this promote to longevity? So, the fantastic stuff is I've been able to take a lot of this same information and help work with certain teams in senior living on how to implement nutrition in some of these retirement communities, some of the lifestyle yoga practices, stress meditation relief, those type of things. So that's been, really exciting to kind of take, what I've learned. And then, also just my husband and my children and I, we really try to follow this type of a lifestyle. So it's been fantastic, being able to learn from some of the top people out there in the world. Felt very honored to do that and be able to take that in my own lifestyle.
Well, thank you so much for, unfortunately, we're at the end of our time. Thanks, Jennifer, for your presentation, and for all of you for joining in this session today. Recordings of these presentations will be available in June to be accessed through the conference website. We've got, between Dr. Sundstrom and I, will connect all the people who want to collaborate here, and Jennifer has put up her information if you want to get in touch with her. Thank you, everyone, and thank you, Jennifer.
Thank you, Dr. Stein. Thank you, Ryan. Appreciate it. Thank you for watching. Stay well.